Hi, I'm Dr. Carol Lawyer. I'm the creator of EchoVet. I'm a board-certified cardiologist. I've been in clinical practice for a long time and performing ultrasound and echocardiography for even longer. This is an introduction to EchoVet and veterinary ultrasound simultaneously. EchoVet is browser-based veterinary software for both abdominal and thoracic examinations, and this is just going to cover EchoVet in really broad strokes. Folks have been overwhelmed by the modality of ultrasound, and we've got a way to keep it simple, both in how people can learn veterinary ultrasound and implement veterinary ultrasound in general practice. I believe that an ultrasound probe will become an extension of a physical exam, just like a stethoscope. It certainly is in my practice and has been for decades now. So here's how veterinary ultrasound is organized, and EchoVet's organized in the same way. There's fast scans for effusions, and then point of care or pleural and lung ultrasound for emergency cases where the emergency veterinarians are going to live a lot. And then there's the basic abdominal of the big five: liver, gallbladder, spleen, urinary bladder, kidneys, and a general veterinarian would do this many times per day on sick animals. And then there's basic thoracic with basic measurements and basic findings. And then we go to complete examinations of both body cavities. So in the fast exam, you can see EchoVet is laid out in an orderly fashion. And so the first is a fast exam where we're just looking for effusions in the abdomen and into the chest. And we can look for pneumothorax as well. In the point of care and plus examination, now we're answering questions. These are emergency questions. Is there abdominal effusion? What's urine production? Is there signs of anaphylaxis in this patient? And we answer questions in the chest as well. Is there effusions? Are there wet lungs? Is there pneumothorax? And then we answer questions again about the heart. Is there a pericardial effusion? What's contractility? Is left atrial size increased, suggesting cardiac disease causing signs in this patient? Then it moves logically to basic abdominal with the big five: liver, biliary, spleen, bladder, urinary tract. And there's more I'll show in different videos about how all that's organized. This is just the big strokes, and we keep moving over to thoracic measurements. We'll do basic measurements, and then we do basic findings in the thorax. We'll go through all this in finer detail. And then there's a complete abdominal exam with everything that you could see in a belly, basically. And then complete thoracic, where I live all day, every day, and I've lived in this for a long time now. And this has about everything you can put into an echocardiographic exam. And that's it. Veterinary ultrasound organization is the same as EchoVet organization. So this makes it simple and understandable and learnable and usable. And then we just provide so much more. We show value for your exam. You present a report to a client instead of a scribble in a medical record. So now your client sees value for your ultrasound exam, and as much as you put in will display for you, and as little as you put in will display for you. We have virtually every measurement in veterinary ultrasound for you to use by species, weight, age, breed. We have breed normals, and it's flexible. You can choose the values you like to use. We chart changes over time, and so that it shows value to the client. They can see what's happening with their dog and see why you wanted a dog or cat or horse. They can see why you wanted to change things, see things as change over time. And then I'm excited, there's one-click analysis. You can set everything to previous, and if you measure something, we'll analyze it for you. So there's set findings. So one-click analysis where everything gets analyzed for you, and that has made my throughput much, much faster. So we'll go into more details on future videos in the EchoVet channel. Thanks for watching, and go to echovet.com and sign up, and we'll set up EchoVet for you to use. It's 10 free examinations. There's no credit card you have to put in, and it's really affordable. It's very profitable for your practice. We offer volume discounts, and hit the subscribe button for us for future updates, tutorials, and it helps us get the word out, raises us up in the algorithms so that we can help animals worldwide in veterinary medicine. Thanks for watching.